Welcome to the Shift information session. We're just going to take a few minutes before we get started for everyone to settle in. Thank you for joining us today. It's a pleasure to see everybody and hopefully get to know you over the question and answer period. Today I'm joined by several of my colleagues, so I'm going to start to introduce them in a few minutes, and I'll get to tell you a little bit more about the Health Leadership Academy. I hope you had a wonderful day. And I'm grateful that you created some space to join us this evening to learn more about Shift and a little bit more about us at the HLA. Well, again, if you're just joining us, welcome to the Shift information session. We're just going to take a few minutes for everyone to get settled and get to know everybody. Thank you for joining us. I know you had other things you could have been doing this evening, but you're here with us, so it's really nice to have you. I'll check in with my colleagues to just make sure we're settling in, and they're going to give me the cue on when to get started. Okay. So, welcome to the Shift information session once again. My name is Amanda. I'm the manager of the Health Leadership Academy. I've had the pleasure of working with the Academy for several years now to advance health leadership education. And today I'm joined by Laura, our program administrator.
Hi, everyone. Thanks for coming out.
If you have any questions over the course of this period, please feel free to type them into the Q&A box or chat, and Laura will address them immediately or wait until the Q&A session today. I'm also joined by Joanna, our communications officer.
Hi, welcome.
And lastly, but not least, I'm joined by Dr. Sean Park, Assistant Professor of the Faculty of Health Sciences and Faculty Lead for Shift.
Hi, folks. Thanks for joining us tonight.
So on our agenda today, we're going to introduce you to the Health Leadership Academy and talk about the SHIFT program and its experience. Then you'll have an opportunity to ask us any questions you may have. This session will be recorded and made available for viewing at a later date. If at any period of time you'd like to have a personal conversation with myself or Laura, we'd be more than happy to speak with you over the phone or by video chat. And I suspect Dr. Sean Park might also be open to doing the same. So our team's pretty engaging and willing to always connect with you. So the Michael G. DeGroot Health Leadership Academy is a joint venture between the Faculty of Health Sciences, the DeGroot School of Business, and the Michael G. DeGroot School of Medicine at McMaster University. What's unique about the Health Leadership Academy is our interdisciplinary approach and forward-thinking approach to health leadership education. We strive to have a transformative impact on global healthcare by nurturing a community of future leaders. This year, we're offering a portfolio of 3 leadership programs for aspiring and current health leaders that focus on learning and unlearning the necessary skills to navigate and adapt to an ever-changing health environment. This program on offer includes the Emerging Leaders Program, which is a 1-week intensive leadership program for students and young professionals to gain leadership skills across the health system. And there's also Pathfinder, an 8-week personalized leadership development program to lead the leadership capabilities of health leaders. But today you're here to learn more about SHIFT, a 3-month virtual project-based program that introduces design thinking for health leadership. SHIFT is one of the few programs to apply design thinking to health and to test new ideas and imagine new health futures. Through a series of interactive design workshops, you're going to be able to experience and think and act from a human-centered perspective to improve the experience of those you currently serve or those you want to serve. So between the session, learning is actually very flexible and experiential, so you can apply and practice what you learn back to your professional life. Over the 3 months of SHIFT, you'll engage with and interact with many stakeholders and experts from across the health system. So not only will you be able to apply what you're learning in real time, you'll be able to gather new perspectives and grow your networks with people who you truly deeply invested in this work of doing and learning with you. So who is a candidate for SHIFT? SHIFT is tailored for health professionals, administrators, educators who are really interested in enhancing their creative learning, problem-solving skills, scenario development, and collaboration capabilities. Health entrepreneurs and entrepreneurs looking to lead change in the health system will benefit from the program, as will university faculty engaged in health-related teaching and research. Graduate students, postdoctoral students, medical residents, and young professionals exploring opportunities for innovation for health and in health are also very much encouraged to apply. So the program itself occurs over 6 live workshops that are scheduled 3 months that occur on Thursday afternoons. The live classrooms occur bi-weekly, and attendance at these sessions is incredibly valuable as you'll be applying your design skills alongside your colleagues during the live workshops. So these sessions are supplemented by 2 to 3 hours a week of offline readings, team meetings, videos, interviews with project stakeholders. And the team project itself, which you'll learn more about soon, is focused on a current challenge in health leadership. Project teams are formed with participants from a range of disciplines, industries, roles, and levels of experience. Your application and interview itself will actually inform how your team is formed. Teams are supported by small group coaching consults and project mentors throughout Shift. And this course uses industry standard tools for communication and collaboration. So those tools include Zoom, Mural, Slack, and it's a way for you to actually build your portfolio, if you will, of knowing and doing in a different kind of way. As outlined here, Shift themes and topics include design thinking and an introduction to what that is, mapping your stories and trends of the data that you're collecting, defining opportunities, imagining new health futures, testing and learning to iterate on your project solution, and showcasing and reflection your progress in design and its outcomes. So it's often hard to capture the essence of Shift when you haven't experienced it for yourself. So let's watch and learn more about what that means for you and how design thinking our approach to why it matters in the health sector.
Design thinking is a way of understanding people's stories, their emotional needs, then quickly identifying and testing out new ways of meeting those needs.
I think one of the things that was really exciting about it was being able to see something evolve, being able to see a challenge and watch it evolve from just a concept to an actual prototype. And then being able to also have the opportunity to go beyond the course with support from faculty and implement it. Everything we did from being able to interview various stakeholders, being able to draw out our prototypes, to being able to do our own research and identify what was important to us. Those things really made this an interesting and exciting class. One of those classes that you didn't actually want to finish, you wanted to continue it for a longer period of time.
Shift is a good mix of practical, hands-on learning with strong academic foundations. The program gives folks an opportunity to think about what kind of change do we want in our healthcare system? And really, what does it feel like to engage in messy innovation work? One of the things we teach our participants is to value the stories of our patients, of clinicians, of managers, of all the people in our healthcare system. And it's really about how we include and make sense of these perspectives as opportunities for sensing where the challenges are and how to create solutions for them.
As an occupational therapist by background, I see a lot of health system related issues, and anybody does who works in the health field. I think we see a lot and we don't know what to do with it. And design thinking really gave me the skills to be able to know what to do with it and an approach to know how to create solutions to existing health issues.
So let me sort of just very briefly give you folks a bit of a sense of what we do with in design thinking. Uh, Design thinking's emerged from a number of different disciplines, design, anthropology, and now in business as well. And the take that we have, and you're going to see different things out there in the marketplace, but what we do is we take the first of all the view of lived experience, that any of the challenges that we're trying to address, and we think of them as the wicked problems that necessarily don't have solutions, but definitely are things we can do something about, that we really need the perspective of those that we're serving. And we realize that it includes citizens and patients, but also all the other stakeholders that are required to make our healthcare system work. So we need their viewpoints and their stories. So design helps us sort of capture some of that. But the other piece as well is we need a different view of the system. We call it a 10,000-foot view. And so this is about looking on the horizons. No one might have thought that we would be here with COVID and this kind of situation. But if you actually look back, there are people who are imagining new kinds of worlds, new scenarios, and had actually suggested a number of things that we might do to prepare for this. So part of what we do in this is to think beyond the present needs and say, what do we need to anticipate down the road for healthcare? And so this is about giving you folks some tools and some provocation to frame new opportunities for where healthcare is headed. And how do we engage in that work of imagining a different future, a different set of scenarios, if you will? And that's actually what we do is whatever, depending on the theme is, we get you to construct scenarios and experiences and solutions for what we call a desired future, right? And to think if that's where we want to go, and now what do we need to do to get there? And a big part of that is about conversation, about dialogue, that any of the design work that we do needs to engage again and again and again with the voices and the perspectives of those that we are trying to serve and are doing the work. And so we do a lot of stuff around iterative prototyping. So depending on the solution to the challenge you come up with, you'll get a chance to revise it in dialogue with stakeholders through the process. So the experience, I mean, there's no other way to really learn this stuff other than to experience the process, the visceral experience of trying to engage and connect with lived experience. And so what we do is we've set up a number of milestones and activities that really kind of guide you through the process and move you into action. This is heavily biased towards action and doing. And so we set up a number of things for you to have dialogue with other participants, but also with stakeholders and patients and users who you're going to be designing for. And really, the one of the big benefits of this is that the other folks in the class are those like-minded folks who are looking for ways to innovate and think about how to change the system. So you'll find yourself among like-minded folks, but also folks who have diverse experience. And so there's a really strong networking component to this. And I mean, part of what makes this so rich is that we bring in a number of mentors and guests and stakeholders who have a lot of deep experience in doing healthcare innovation. And you'll get a chance to really connect with them about the work that you're doing, but also around the challenge that we give you. So the project this year, we are going to look at aging in place and the future of aging. I think, this is just sort of a timely opportunity to address some of these challenges that have come up with how we care for the elderly and how we age well and how we die well. And so what we're going to do this spring is we have some project partners, academic and in industry, as well as a number of clinicians and entrepreneurs and managers who are doing work in this area that you're going to get a chance to speak with and to start to look at where can we have some innovation and some new ideas around things like community building and networks, different kinds of spaces for folks to age well with one another. And really the outcome is going to be each team is going to come up with some kind of solution to address the bigger challenges around aging and aging in place, which really we mean folks having the opportunity and the resources to live in their homes as long as possible.
Thanks, Sean. So as you heard in the video and from Emma, HLA alumni benefit significantly from design thinking in many ways, and Shift alumni will too. They appreciate the innovative capabilities and understand how to form design project teams with well-balanced mix of problem-solving skills. And they become adept at design thinking research tools to generate relative, qualitative, and ethnographic data. They're often more creative and can generate future scenarios and interventions to tackle complex challenges that you find in healthcare specifically, using both primary and secondary research to support making how to make those shifts. So how do you get started with us? We welcome you to get started at any time. We are accepting applications on a rolling basis, and applications are already open. After submitting your application, you'll be able to meet virtually with the HLA staff, so Laura or myself and or Sean, in a formal interview setting, which is really more of a conversation. We want to get to know you, want to make sure this is the right fit for you, and address any questions you might have. There is a fee associated with this program, and the fee does include 3 months of virtual programming, all course materials, access to the collaborative tools we mentioned before. There's also access to the project sponsors, project mentors, stakeholders, and experts in the field that are working in aging in place, for example, but that includes, major institutions that you may not be able to work with in other ways yet. Or perhaps you do, maybe they're already your collaborative partners. So there's also access to virtual platforms and technology and a certificate of completion from McMaster University at the end. So in terms of events that are coming up, I apologize, I don't know why that's red right now, but we do have several information sessions that we have coming up in relation to the other programs and upcoming talks. So we have one with Dr. Park with design thinking and foresight in healthcare innovation. This will be a really relevant talk for you if you were interested in Shift. It's very much aligned with some of the work that we're doing in the course, and I think it will help you understand what the experience will be like in a real way. For further information, you can register on our website. And with that, I'm going to open the floor to questions and turn it over to Laura to get us started.